Out of the coronavirus pandemic, children between 5 and 11 are a step closer to being able to get a coronavirus vaccine. This comes as new research shows the equity gap is closing when it comes to Americans getting their shot. CBS 4's Naomi Ruchim explains.
A new poll shows the racial and ethnic divide closing when it comes to vaccinations. The Kaiser Family Foundation survey finds 73% of Hispanic adults in the U.S. report being vaccinated, compared to 70% for black adults and 71% for white adults.
We know our work isn't done, but this is important progress.
As the push to vaccinate continues, Pfizer submitted data Tuesday to the FDA about the effectiveness of its COVID-19 vaccine in children ages 5 to 11. The drug maker expects to request emergency use authorization in the coming weeks. Meantime, New York is the latest state to impose vaccine mandates for healthcare workers.
I have about 500 nurses who are not currently at work.
About 16% of the state's hospital workers are not fully vaccinated, meaning more than 83,000 are at risk of losing their jobs. Deborah Conrad is a nurse in Western New York suing the state over its vaccine mandate.
I'm wearing the same exact PPE I've worn the whole pandemic, and it's always kept myself and patients safe. Why has it changed?
And federal health officials say hundreds of thousands of Americans have already received their booster shots.
Once I heard that we were cleared to get the booster in my age group, I wanted to sign up for it.
The CDC says new data shows the boosters are well tolerated and most adverse reactions were mild or moderate. Naomi Ruchim, CBS News, New York.
According to new data from the American Academy of Pediatrics, 206,000 new COVID infections among children last week made up more than a quarter of all new cases. But it's also worth noting weekly infections have declined for the past 3 weeks.